Part 1 Introduction. Why you should never ignore joint pain. After 50. Hello, I'm Dr. William Hart. Today I'm not just here as a physician. I'm here as someone who has lived through over 60 winters. Someone who has listened to thousands of stories. Stories from fathers, mothers, grandparents. People just like you. I'm here to have a conversation that I believe everyone over 50 needs to hear at least once in their life. Let me ask you to imagine this. It's an autumn morning, the air is crisp, the window still fogged with mist. You get out of bed and your knee aches sharply as if it's reluctant to wake up with you. You push forward. Your hand trembles slightly as you hold your cup of coffee. Your wrist feels locked in place. You chuckle, must be the weather. But then it happens again the next morning. And the one after that, you begin to reassure yourself, well, I'm getting older. This is normal. But you know what? That's exactly when something dangerous starts to happen. We begin to accept the pain. We negotiate with our bodies. And worst of all, we stop listening to the important signals our bodies are trying to send us. Let me tell you the story of Mr. Robert, a patient of mine from Texas. He's 67, a retired construction engineer. The kind of man who once climbed rooftops in blistering heat, and yet now just bending down to tie his shoes causes such pain in his knees that he has to brace himself just to get back up. He came to see me not for joint pain, but because he couldn't sleep. It took me almost 30 minutes of talking before we realized it was the chronic joint pain, the one he had gotten used to that was silently stealing his sleep. Have you ever felt that way? A pain you thought was minor, but it clings to you day after day until you forget what it's like to feel not in pain. I'm not saying every joint ache means something serious, but I want to make this very clear after 50, every unusual signal from your joints deserves to be heard, because it might be a quiet warning of inflammation, degeneration, or even early signs of autoimmune conditions like rheumatoid arthritis, gout, or lupus. Did you know, according to the CDC, more than 58 million American adults live with arthritis? And the alarming truth is most of them go undiagnosed for years because the early symptoms are subtle or brushed off with that old phrase, it's just part of getting older. This is something I always tell my patients. Aging doesn't cause arthritis, but it does make your joints more vulnerable and healing slower if you ignore the warning signs. I once worked with a former elementary school teacher, Linda. She was 62. She came in because her hands ached slightly when she wrote. She thought she was holding the pen wrong, but after asking a few questions, she realized the pain always showed up in the morning and was accompanied by about 30 minutes of stiffness. It only eased after she drank warm water and massaged her hands. I immediately suspected early-stage rheumatoid arthritis, and her blood tests confirmed it. Because we caught it early, we were able to manage it with lifestyle changes, physical therapy, and natural remedies. Today, Linda still teaches part-time rights daily and hasn't needed strong painkillers at all. Why do I share these stories? Because the smallest signs, if ignored, can cost you the best window of opportunity to manage your condition. But if you learn to observe, listen to, and understand your body, you won't just reduce pain, you'll keep the reins of your life in your own hands even beyond 60. Today, I want to walk with you through 7 essential signs that anyone over 50 should know to tell the difference between normal aches and the early warnings of arthritis. I won't just tell you, I'll share real stories, lessons from decades of experience, and practical ways you can start caring for your joints today. Are you ready? In the next part, we'll explore the first sign, and it might be the most commonly overlooked one. But before we go further, I want you to ask yourself a simple question. When was the last time I truly listened to my body? Hold on to that question and walk with me through this journey. Part 2, the first sign seems small but shouldn't be ignored. Sign 1, morning stiffness, lasting more than 30 minutes. Let me paint you a picture, a typical morning in the life of someone over 50. The clock strikes 6 a.m. You wake up, reach out to silence the alarm. But your wrist feels stiff as if dried glue has cemented your joints overnight. You try to rotate your ankle to step out of bed, and it lets out a painful pop. You make your way to the bathroom. Every movement, from lifting your arm to brush your teeth to bending down slightly, feels like negotiating with your body. Every step, every twist comes with a tiny groan. And it takes at least half an hour after some massaging warm water and slow pacing around the house for your joints to finally cooperate. Have you felt that way before? If yes, please don't ignore it. This is the most classic sign of rheumatoid arthritis, an autoimmune condition where your immune system, instead of protecting you, begins to attack your own joints. Morning stiffness that lasts longer than 30 minutes, especially in small joints like your hands, wrists, or feet, is one of the earliest red flags. Unlike osteoarthritis, where pain tends to worsen as the day goes on, rheumatoid arthritis flares up first thing in the morning. If undetected, it can cause permanent damage to cartilage bones and even lead to joint deformity. One of my patients, Joanne, age 61, thought her stiffness was just from the cold northern climate. But when I asked a few more questions, she said, every morning my hands feel like pliers, stiff and immobile. I have to cradle a hot tea mug for 20 minutes before I can move them. We ran RF and anti-CCP tests, both came back positive. Fortunately, with early treatment, she regained nearly full joint function within 6 months. I want you to remember this. Never treat morning joint stiffness as a normal part of aging. It may be your body's first whisper begging you to listen. Sign 2, slight swelling, warmth, or redness in joints without fever. Your joints can speak not in words but in signs. They swell, they flush red. And when you touch them, they feel slightly warm, as if a tiny fire is smoldering beneath the skin. Most people brush this off. Maybe I overused it, they say. But if your joint, especially symmetrical ones like both hands or both knees, is slightly swollen, warm to touch, and red without any actual fever or injury, it could be the start of chronic inflammation. Rheumatoid arthritis, gout, psoriatic arthritis, they can all begin with these quiet, mild flares. Not sharp pain, no loss of function, just an annoying, lingering discomfort, a sign that's easy to ignore. I remember Mr. Henry, a retired chef from California. He came in with mild swelling in his right index and middle fingers. I probably held my knife too tight, he laughed. But when I examined him, I noticed the same swelling on his left hand, even though he wasn't left-handed. Blood work confirmed early-stage rheumatoid arthritis. We caught it in time. A few months later, he called me and said, I can dice onions again and not cry. Not from the onions, but because I'm so relieved. I laughed out loud that day. See, a little swelling can be a valuable warning if you know how to listen. Sign 3, pain that worsens at rest but improves with gentle movement. We tend to think joint pain means we've overused something. But if the pain gets worse after resting, after sitting too long or lying down, that could be inflammation talking. I had a patient, David, 58, an amateur guitar player. He told me, my shoulder kills me when I sleep on my side. But if I get up early and stretch a bit, it actually feels better. That's inflammation pain, not mechanical pain. With light movement, your joints get better blood flow. Synovial fluid circulates, relieving pressure and nourishing cartilage cells. But when you rest, the fluid stagnates and inflammation builds up, causing stiffness, pain, and a heavy sensation. So if you find yourself in the most pain after watching TV after a nap or first thing in the morning, don't dismiss it as just aging. That's your body trying to tell you something. These first 3 signs, morning stiffness, mild symmetrical joint swelling, pain that worsens with rest, they're all familiar, seemingly harmless, but they may be your joints gently knocking at the door, trying to get your attention. And the question is, will you open the door, listen and take action, or will you shut it and let the knocking grow louder day after day? In the next part, we'll explore 4 more signs, including whole body symptoms like fatigue, weight loss, and low-grade fevers that most people never associate with their joints. And I'll share the story of Mrs. Rose, a 70-year-old woman who thought she had mild depression, but whose body was quietly crying out through her joints. If anything I've said so far resonates with you, feel free to share your thoughts in the comments. That might be the first step toward your healing and a lifeline to someone else silently searching for answers. Part 3, the whole body symptoms. When the body cries for help in subtle ways. We often think joint pain is just joint pain, but the truth is joints are never isolated from the rest of your body. When one joint is inflamed, truly inflamed, your entire body responds. Quietly, subtly. But if you learn to listen, you'll realize your body always finds a way to alert you. Sign 4, ongoing fatigue. Even after a full night's sleep, think back to this morning or maybe yesterday. You slept 7 or 8 hours undisturbed. No loud noises, no interruptions, and yet, when you opened your eyes, it felt like your energy had been drained, as if you just climbed a mountain even though you never left your bed. Have you felt that kind of exhaustion? Many people chalk it up to aging, or maybe a vitamin deficiency, or worse, I'm just being lazy. But for people over 50, that kind of fatigue could be a key sign of rheumatoid arthritis or another autoimmune inflammatory disease. Here's why: in chronic inflammation, your body is constantly on internal alert. Your immune cells are activated. They release cytokines, the chemicals that cause inflammation. It's like a low-grade fever burning quietly inside you. And that internal effort drains your energy no matter how much rest you get. I remember a patient, Martha, 64. She told me, "Doctor, it feels like I've been wearing a wet blanket on my shoulders all day." Tests later showed she had psoriatic arthritis. After 4 months of treatment, she came back smiling. "The blanket's gone. I feel like myself again." Fatigue that lingers isn't weakness. It could be your immune system asking for help. Sign 5, low-grade fever without a clear cause. Have you ever felt your body heat up in the evening or noticed your temperature creeping up to 95 or 100.4 37.5, 38 degrees with no cold, no flu, no signs of infection? That's not the common cold. That's an inflammatory fever, a sign your immune system is running overtime. It happens in autoimmune diseases like rheumatoid arthritis, lupus, or ankylosing spondylitis, even in the early stages. You might not have a cough, no sore throat, no chills, but you feel weak, foggy, unfocused. You've lost your appetite. And if those symptoms come with joint pain, stiffness, or fatigue, please don't ignore them. I had a patient named Leonard, 67 years old. He'd been misdiagnosed with lingering viral infection. But when we ran inflammation tests, CRP and ESR both were unusually high. An MRI showed inflammation around his hip joints and lower spine. It was early-stage ankylosing spondylitis. We treated it early, and now he's back to riding his bike around the lake every morning without needing pain meds. So if you've had a low-grade fever that just won't go away, don't just think flu. Think joints too. Sign 6, unexplained weight loss. Here's a sign few people connect with arthritis: losing weight for no reason. You're eating normally, maybe even less active because of joint pain, but your clothes feel loose. You glance in the mirror and see hollow cheeks, thinner arms. You haven't made any big lifestyle changes yet, the weight keeps dropping. What's happening? In autoimmune diseases, your body is secretly burning energy constantly. It's fighting inflammation. Even when you're sitting still, your metabolism stays elevated as if you're running a marathon inside. This isn't healthy weight loss. It's a sign the inflammation is spreading. Let me tell you about Mrs. Rose, the woman I mentioned earlier. She lost nearly 15 pounds in 3 months without dieting. She assumed it was late-life depression. She'd lost interest in food, didn't feel like herself. But when we tested her, she had low ferritin, high CRP, and fluid around her right knee joint. It was rheumatoid arthritis. 6 months later, after treatment and lifestyle changes, not only had she regained her healthy weight, she also regained the spark in her eyes and the joy in her smile. Sign 7, tingling numbness or loss of grip, especially at night. Here's one more surprising sign: numbness or tingling in your hands at night. You're asleep and suddenly your hand feels like pins and needles. You shake it out, wait for it to go away. During the day, you feel weaker when gripping things. You drop your water glass. Buttoning your shirt gets harder than usual. This is often mistaken for carpal tunnel syndrome, but in people with rheumatoid arthritis, joint swelling in the wrists can compress the median nerve, causing the same symptoms. I once treated a retired seamstress named Dorothy. She could no longer sew at night. Her hands felt like they were being zapped with electricity. She thought it was just aging, but an ultrasound showed inflammation around the wrist, causing nerve pressure. After treating the inflammation and doing regular physical therapy, she returned to her sewing table and said with a beaming smile, "My hands came back to life, doctor." Tingling hands when combined with joint symptoms is your body's SOS. Please don't ignore it. As you can see, arthritis doesn't only affect your knees, your fingers, or your spine. It seeps into your sleep, your mood, your weight, and the way you feel inside your own skin. And most importantly, if you recognize these signs, don't blame old age. Get checked, run the tests, give your body the right to be heard. In the next section of this video, I'll help you understand how to tell the difference between inflammatory arthritis and osteoarthritis, when you should see a rheumatologist, which simple blood tests can help with early diagnosis, and finally, a few small daily habits to start nurturing your joints again, one gentle step at a time. If you've seen a bit of yourself in these stories, write in the comments below. Now I understand, because once you acknowledge your pain is real, the healing journey can truly begin. Thank you for staying with me this far. Now grab a seat, Take a breath and let's step into the next chapter, where we finally draw a clear line between osteoarthritis and rheumatoid arthritis, and why understanding that difference could change how you live with. Part 4. Telling the difference between osteoarthritis and inflammatory arthritis. Understanding to heal correctly. I want you to imagine two friends. Both are in their 60s. Both suffer from knee pain. The first one, let's call him John, feels pain when standing up, sitting down, or climbing stairs. His pain gets worse as the day goes on, especially with lots of movement. But when he rests, uses a warm compress, the pain fades. His joints don't look swollen or red, maybe just a little stiff with some cracking sounds. The second friend, Ellen, wakes up each morning with swollen knees. They feel tight, warm, and sore, making it hard for her to walk at first. Oddly enough, after walking, a little things get better. But even while resting, lying in bed, she still feels aches and pressure in her joints. She often wakes up at 4 a.m., not from a bad dream, but because of joint pain. Can you feel the difference? John has osteoarthritis, the natural wear and tear of aging. Over time, the cartilage in his joints wears down and movement becomes painful. Ellen, on the other hand, is facing inflammatory arthritis, where the immune system attacks her own joints. Her pain doesn't come from movement, but from inflammation. And it doesn't rest even when she does. Let me simplify this for you. Osteoarthritis is like a tire slowly wearing down over time. Inflammatory arthritis is like a hidden fire burning inside your joints every hour of every day. And because of that, the treatment is very different. If you're dealing with osteoarthritis, we focus on reducing the pressure on your joint, strengthening surrounding muscle, adding nutrients that support cartilage, encouraging proper movement and posture. But if it's inflammatory, then the priority is to calm the immune system, control the inflammation, prevent permanent damage to joints and bone. That's why I always remind my patients, we can't stop time, but we can stop inflammation. Understanding this difference is not just helpful, it's life-changing. Because treating the wrong type of arthritis can lead to more pain, more frustration, and more damage. Now you might be asking, so how do I know which type I have? Do I really need to see a specialist? And the answer is, if you've been feeling the signs I mentioned earlier, yes. In the next part of our conversation, I'll walk you through when you should see a rheumatologist, what simple tests you can ask your doctor for, and how catching arthritis early can preserve not just your joints, but your way of life. If you've been nodding along or feeling a sense of clarity right now, you're not alone. Thousands of others over 50 have gone through what you're facing. But the difference lies in this. Some wait, others take one brave step toward understanding. I believe you are the second kind. Let's move forward together. Part 5. When should you see a rheumatologist, and which tests can help you know for sure? I know that for many people over 50, especially in the US, the idea of going to a specialist can feel overwhelming. You might think, it's just some joint pain. I've lived with this for years. Why now? I don't want to make a fuss. But if you've experienced any of the following symptoms, I sincerely urge you, as someone who's seen this too often, please schedule an appointment with a rheumatologist. Swelling in one or more joints lasting more than 2 weeks, morning stiffness that lasts longer than 30 minutes, fatigue that lingers even after a full night's sleep, low-grade fever with no clear cause, pain on both sides of your body, like both hands or both knees, tingling or numbness, especially at night, unexplained weight loss. These are not simply signs of aging. They are your body waving a red flag, quietly, patiently hoping you'll listen. Let me share this. You don't have to wait for the pain to become unbearable to seek help. The earlier you act, the more power you have to protect your joints. What tests should you ask for? When you visit your doctor, even your primary care provider, there are a few simple tests you can request to screen for inflammatory arthritis or autoimmune issues. These include CRP, C-reactive protein, a marker that rises when your body is inflamed. If your CRP is elevated, it's a sign your immune system may be overactive. ESR, erythrocyte sedimentation rate, another inflammation marker. High ESR means your body is likely fighting something silently, possibly chronic joint inflammation. RF rheumatoid factor, and anti-CCP, anticyclic citrullonated peptide. These are specific tests for rheumatoid arthritis. If both come back positive, there's a high likelihood of RA, an anti-nuclear antibody. This test helps detect autoimmune diseases like lupus. If your body is attacking itself, this is one of the first tests we run. And if your doctor suspects joint damage or deeper inflammation, they may recommend joint ultrasound to detect early signs of joint lining inflammation, MRI scans to view changes in joint tissues, tendons, or ligaments before x-rays show anything. A real story. George's quiet warning. Let me tell you about George, 62 years old. He came to see me for a simple complaint, tingling in his right hand for the past 3 weeks. Nothing serious, no visible swelling, and a normal x-ray. But something didn't sit right with me. So I ordered an ultrasound of his wrist, and we found inflammation in the synovial lining, the soft tissue that surrounds the joint. It was an early sign of autoimmune arthritis. And because we caught it early before any joint damage had set in, George was able to begin a treatment plan that didn't require steroids or harsh medications. Today, he still plays bowling every weekend, no wrist pain, no nerve issues. That's the power of early detection. It doesn't just save joints, it saves routines, hobbies, confidence. It saves joy. So if something feels off in your body, don't wait. Ask your doctor for these tests. Seek a referral to a rheumatologist because you deserve answers. You deserve care. And more than anything, you deserve to move freely without fear. In the final part of this video, I'll share with you a few gentle daily habits you can begin tomorrow morning to show love to your joints. Foods that help calm inflammation. Simple movement routines to wake up your joints gently. And one beautiful thought I carry with me every time I help someone fight back against pain. If you've made it this far, I want you to know I see your effort. I see your heart. And I believe that healing begins the moment you believe you're worth healing. Let's finish strong in the next part. Part 6. Simple things you can do to love your joints every day. Now, if you're still wondering, so what can I actually do starting tomorrow morning? Let me offer you a few gentle, easy steps, small changes that can make a real difference. You don't need a gym membership. You don't need expensive supplements. You just need a bit of awareness and a little kindness to your own body. Move your joints for just 10 minutes each morning. Start your day by waking up your joints just like you would stretch a musical instrument before playing. You can gently stretch your fingers, rotate your wrists in slow circles, bend and straighten your knees, roll your shoulders and ankles a few times. It's not about how long you move. It's about showing up for your joints, especially first thing in the morning when stiffness tends to settle in. 2. Drink a glass of warm water after waking up. This may sound simple, but warm water helps wake up your digestion, flush toxins, and get your joints moving smoothly. Many of my patients say this one habit alone makes a huge difference in their morning stiffness. 3. Add anti-inflammatory foods to your meals. Your kitchen can be your pharmacy if you choose the right ingredients. Salmon, sardines, or mackerel rich in omega-3s. Turmeric and ginger, natural inflammation fighters. Chia seeds, flax seeds, walnuts. Plant-based nutrients that soothe your joints. Think of these foods as nourishment for your cartilage, fuel for your healing. Or reduce foods that promote inflammation. This doesn't mean cutting everything out, just being mindful. Try to limit deep-fried food, refined sugars, excessive red meat or processed meats, soda and sugary drinks. Wafru, because these can fuel the fire inside your joints, making inflammation worse. 5. Don't sit too long. Give your joints a break. If you're sitting for more than 30 minutes watching TV, reading, or at the computer, stand up. Walk a few steps, gently roll your shoulders, or circle your ankles. Just a minute or two can keep your joints from stiffening up. You see, taking care of your joints doesn't require big leaps. It starts with little rituals repeated with care. I once had a Japanese doctor tell me, joints are like string instruments. If you don't tune them every day, they lose their tone. Eventually they snap. That has stayed with me ever since. Joints are living parts of us. They respond to touch, to care, to how we move, eat, and rest. And above all, they respond to how we listen. Final words. Joint pain is not your destiny. My friend, if you've stayed with me until now, thank you. You are not someone who gives up. You are someone who is ready to reclaim your health. Let me leave you with this. Joint pain is not a life sentence. It's a signal. And like any signal, you have the power to listen and to act. You don't have to suffer in silence. There are ways to relieve pain, restore function, and return to joy even after 60. But first, you must believe that you deserve to feel well again. So I leave you with one final question. Are you willing to take one small step to begin the healing journey for the joints that have carried you all your life? If your answer is yes, please leave a comment below that says I'm ready. I read everyone. And we will keep walking together one video at a time until your pain eases and your life feels lighter. If this video has been helpful to you, please don't forget to click, like, subscribe, and share it with someone you love. because somewhere out there, someone is silently struggling, and maybe they need to hear exactly this message. I'm Dr. William Hart, and I believe that after 50, we don't live less, we live deeper. Take care, and I'll see you in the next video.